in all sorts of pain, but it's different kinds of pain. They've got headache pain. Sometimes it's more pressure, like behind the eyes, or other times it's your like migraine pain. Um, uh, but they've got all this different pressure or pain in their head, and sometimes it's pinpoint, like it's right here, And I've never had a headache where I can touch like it's exactly right here in my brain, and they're touching the spot on their head, and it'll be a sharp pain sometimes. And anyways, but they come in with the emotional pain, like they've lost themselves, they feel like a lot of times. And depression and anxiety are very prevalent with head injuries, with post-concussion syndrome. Apathy, they've just lost motivation. Um, and the irritability, everything, their sensory systems are so out of whack that it can be visual stuff. Maybe it's just light sensitivity or noise sensitivity, but a lot of times it's just being in a room where a lot's going on. They can't process it. It's almost like a sensory integration pain, at that point. And people don't usually use the word pain with some of these symptoms that are going on. But when they come into our clinic, I feel like they're going through all sorts of things they can't describe. And to me, it's okay, you've got emotional pain, you've got physical headache pain, you've also got whiplash and actually some neck pain and back pain, maybe. Those are often associated with car accidents and sports injuries. And anytime you hit your head pretty hard, your neck's likely to be somewhat involved. Um, and and then you have symptoms that are like balance, dizziness, word retrieval issues. So a lot of social stuff ends up happening because you can't process what the other person's saying quick enough to respond to it. So you decide not to interact at all, socially.
That sounds like me trying to converse in Spanish.
Oh, there you go. Yeah. Well, it's almost like they forgot English. It is a little
Mm,
bit. It's parts of it because what's going through their head is, I want to say this, but I can't think. And we all have this to a little degree. I just can't come up with that word. There's a word and I can't get it. If you amplify that a few times, like 3 times or 5 times, maybe 10 times as bad, where you just can't come up with words, you can imagine how hard it would be to do anything where you're engaging, conversationally. So um, they'll often have vision issues, blurry vision, and mostly eye doctors have not quite figured out the connections between brain injury and their vision issues, because I get a lot of question marks. I've been going to the eye doctor. They changed my prescriptions. They gave me prism glasses to try to help my eyes, do what they're supposed to. Um, and I'm like, oh, it's convergence and divergence. So the angle of your eyes pointing in or out. If I'm looking at my nose, they're going to point in a lot. If I'm looking at a mountain, they're going to go, out a lot. And the
mm.
part of the brain that controls the muscles on the outside of the eyeball that do that gets involved with concussions. Most people who have post-concussion syndrome also have some visual stuff affected. For some reason, the integration gets messed up, and you've got one eye on target, but one eye off just a little bit, which creates a blurry image. Your prescription hasn't changed at all. Your eyes are still fine, but your brain is not getting the eyes at the right angle. And then it usually recognizes it, and then it'll get it at the right angle, whatever part's compensating in your brain for that part that's inactive. So then it'll be clear. So it'll be blurry and then clear and blurry and clear. So they have a lot of vision issues, um, a lot of just problem solving, decision making, attention and focus. Um, there's just so many symptoms that are typical concussion or post-concussion symptoms. Um, I've got
Thanks for watching this video, and don't forget to like and subscribe to the channel.